Hi, good morning, everybody. I hope you guys are having a good week so far. I am here to present my chapter 3 poster. It looks like a lot, so I'm going to walk you through each section. Yeah, it's been kind of cool to see how our discussion boards have directly contributed into this poster. It actually made it fairly simple to put together, which is great. So, yeah. Okay, so looking here, you can see in the beginning, if you have been with me for the other seminars, you know I'm the menstrual cycle girl. And so the purpose of this study, the effect of premenstrual syndrome symptoms on power production in collegiate athletes by me, is to determine if there's any differences in power performance when we're comparing back to PMS or premenstrual syndrome symptoms. And so I'm going to be comparing 5 days pre-period, and I'm going to have the girls take the MSQ, which I'll talk about here in a little bit, to determine what their symptoms are, how frequent those symptoms are happening, how severe they are, and then I'm also going to have them jump on force plates, and I'm going to compare the two. It's fairly simple, but just to kind of flush it out a little bit, just with female athletes and with menstrual cycle, it's really tough to study this area. There's just so many differences between hormonal birth control and everybody's period and menstrual cycle as a whole is different. So it's tough to study this. Hopefully, I'm going to do my best to isolate some of these things. There's also been lots of different methodologies used to reach conclusions about the menstrual cycle and performance, and that makes it really difficult to compare studies and replicate studies. So keep that in mind. This hasn't been done before, even though it is simple. So I'm kind of pulling from various different places for this. And then oftentimes we're looking at the phases and the symptoms, but we have to differentiate between the two. Um, Sometimes, and usually actually, the reason people perform worse at different points in their menstrual cycle is not because of the phase they're in, but it's because of the symptoms they're feeling during that particular phase. And so that's what I'm hopefully going to isolate here in this study. We are hypothesizing that they will experience higher levels of power when they have lower symptoms and vice versa. So it will be an inverse relationship, maybe, that we see. Um, but again, who knows? Anything could come from the data, and that's where I got to check my bias. So moving down to the researcher bias, I think probably the most helpful discussion board we did through this seminar was the positionality, which is so funny because I was so convinced that it didn't matter for me. Um, just looking at some of the bias I recognize in myself, I am a former collegiate athlete. And so when I was in my luteal phase, that's when my performance sucked. To be so frank with you, I had lots of different symptoms, and I still do, and it makes it really tough to exercise and perform well. So I have to be careful not to do confirmation bias and look for that pattern in my data. And I also can't assume that all female athletes have the same experience as I did with my menstrual cycle, because there's tons of individual differences and variability in length and symptom frequency and severity of symptoms, that makes everybody different. So one way I inadvertently accounted for this without knowing it is I did triangulate. So I have two men on my research committee that's going to hopefully help me have objectivity in my data interpretation, and keep me in check when I maybe decide I want to go off the rails a little bit. Moving on to the actual design of the research. So my research question was, how do premenstrual symptom presence and severity affect, sorry, that's a typo, affect power output in collegiate athletes? The answer we came up with for this was a cross-sectional, observational, quantitative research design. So we're not going to manipulate any variables, but we hopefully are going to isolate specific factors within the objective data that we do collect. I chose this particular method because of the individual differences from person to person. Subjects are going to act as their own control. They will be tested over 5 days, and we'll go over that in the procedures and analysis section here in a little bit. With the population, my inclusion criteria, so these subjects have to be between 18 and 25. They do need to be experiencing a regular menstrual cycle, so that's between 21 and 35 days, so they're not polymenorrheic or oligomenorrheic, but they're falling within the normal range. They do need to be participating on either the Division I or club sports teams at Liberty University, just because that is where I am pulling from for my sampling. It will be convenient sampling, but there are hundreds and hundreds of athletes here, so I think that's going to be okay. In terms of some other stuff, they can't have any history of pregnancy in the last year. There can't be any use of hormonal contraceptives in the last year, no hormonal therapy in the last year, no history of hormonal disorders overall, and then no musculoskeletal injuries for the last 6 months. Like I mentioned, I will be doing convenience sampling. And then after doing a power analysis, I was able to find that I need to have at least 21 participants minimum to reach the appropriate power levels for this particular study. I use G-Power to find that. However, I am going to hopefully get more than 21 participants. It is a fairly unobstructive, pretty convenient study for them to participate in if they choose to. Couple of different instruments here, my big three. I will be using the Validated Menstrual Symptom Questionnaire, the MSQ. This has been used in several different populations just to, help accurately identify some of the symptoms and the frequency and the severity. It does utilize Likert scales. So even though it is a questionnaire, it is going to be quantitative data, which I like. Number two is the Clue app. Some of you ladies out there may even use this on a regular basis. It's just a calendar counting application you can use on your phone. It has been used in research studies prior to this, which is why I chose to use this one. And one of the features I really like about the Clue app is that there has something called Clue Connect in it. And so as a researcher, I can have my own profile, which I already do anyway, just to track stuff for myself. And I can connect into each of my subjects and view their tracking. So I can figure out, okay, when are they going to be in their PMS window, which we'll talk about here in a second. And the last is going to be Hawken Dynamics force plates. This is where everyone can laugh a little bit because, everyone does force plate data, it feels like these days, or force plate studies. But we do have them at my school, and I am very excited to use them. So I will be utilizing them, and they also have been validated, and you can see that in the references as well. Check out that study. Popping up to the procedures and analysis. So the subjects are going to be using the Clue app actually for an entire month prior to the testing, just so I can sort of get a gauge of their menstrual cycle. So I can look and see, okay, this is when they were on their period. This is how long it was. This is how long they were in follicular, this is how long they were in luteal, and this is their PMS window, which is identified as the 5 days before your period. Most people think 7, it's actually 5. So hopefully I can use that information to identify the estimated dates for their next cycle and schedule their testing to begin for those 5 particular days. They will continue to use the Clue app during the time between their period and then their next PMS window. Again, that's just so I can better estimate when that 5-day period is going to be. And honestly, this is where I will ask for feedback. If you have any ideas on how to maybe better do this, we do have to estimate when their PMS is, but if you guys think it would be prudent to test for more than 5 days, maybe do 7 days instead, just to make sure we have those 5 days. Or if you have a better idea, please, this is where I'm asking specifically. If you have feedback, throw it my way. Once we figure out those 5 days, we get to that PMS window. Then during that PMS window, they're going to fill out the MSQ. So that's that Likert scale survey about their symptoms. And they're going to fill it out around 10 a.m., hopefully allowing their body to wake up a little bit and accurately feel their symptoms. If they fill it out first thing in the morning, there's a good chance they're going to mark higher symptoms than they would feel. So 10 a.m.-ish. If they're in class, we're going to hopefully come up with a range of time instead of just like at 10 a.m. fill this out. And that way they're able to adjust based on their schedule. So yeah, they'll be using that Clue app. That's when they'll use the MSQ. That's when we'll get the frequency and severity. Each day, the subjects are going to roll into the weight room or into the lab, and they're going to complete 2 trials of the counter movement rebound jump on the force plates. The cool thing is all of these athletes, both in the club sports and in our Olympic sport department, use these force plates on a daily basis for their monitoring. So they're all very familiar with the protocol, which is nice. So it won't take that long to teach them how to do it. They usually do a normal counter movement, although some teams do the counter movement rebound jump. But we'll do 2 trials on each of the 5 days for a total of 10 total trials. We're going to track RSI, we're going to track jump height, system weight, braking force, time to take off, probably. There's lots of different variables. I'm still zooming in on exactly what I want to track, but RSI and jump height are probably going to be our big 2 at least. maybe rate of force development. That's probably also a good one. Once we have 5 days worth of MSQ data as well as jump data, I will be able to do a statistical analysis once we get everyone, at least 21 people. So I will be performing a repeated measures ANOVA just because I am tracking at multiple time points and comparing several different things. So repeated measures ANOVA will be used for the statistical analysis, and I will be using SPSS for that just because I am most familiar with that. So overall, just a little summary here. It is a cross-sectional, observational, quantitative design. My participants will be collegiate athletes. They have normal, regular menstrual cycle, no hormonal interruptions between the ages of 18 and 25. We'll be using the MSQ, the Clue app, and a Hawken Dynamics force plate set. I will be using the same set. It'll just move around with me as I go to test. The procedure will take place over 5 days. We'll measure both symptoms and power output. And again, you can jump back up to procedures if you need a reminder on that. And then we will analyze this using a repeated measures ANOVA. So fairly simple, but I think simple is good in this instance. It's going to help me be able to accurately get this data collection done, and then also to be able to analyze it fairly quickly. Normally I would have a QR code for references, but I only have 3 that I'm using for this particular poster, so they are listed here. If you guys have questions about anything, please let me know, and I'm really, really excited to hear about your studies. So have a great rest of your day.